It's a pan-agency team essentially. It comprises of the health board staff, the local authority social worker staff, and including the care team, as well as a partnership with Age Concern Cardiff. And as a result, the three partners can work very closely together. We're integrated and we're co-located, which means that we're all in the same building, and that's one of the key ways of ensuring that partnership working is such a success as it is here at CELT.
If it's the case, for instance, that someone have had a fall and they have lost their confidence, they may go to the physios first to make sure they're safe mobility-wise, and it might be that they are lacking in confidence and they need some short-term support to get them out and about. That's where I come in, and I will accompany the patients on visits, whether it's to shops or to social activity groups, anything to do with outside activities.
I primarily assess people's performance and their level of independence to manage their day-to-day living skills.
This multidisciplinary approach is better because I can just refer back to them. Say for instance, I've set up a care package, the physios or the OTs are no longer involved, but then the care agency contact me and say, no, there are problems. As long as I'm still involved, that means the whole CELT team is still involved.
Every team member from every discipline, we meet around the table. We have allocation of patients. Now, whatever referral has come in from the night before that morning, we triage them, and whoever's the most appropriate profession to go out, we'll hand them over.
Older people, particularly frail older people, one of the commonest reasons they come into hospital is after a fall. And a lot of these falls are not necessarily injurious in terms of a broken leg or significant head injuries, for example, but fractured confidence and the fear of falling can really take over an older person's life.
The back of my legs used to ache like mad, and because I fell downstairs, I forgot how many times. So I was told to give up all the voluntary work I did. You know, and I came out of hospital, as you say, the first fortnight or so, I was very, very anxious when I went to bed on my own.
Sometimes as well, with a lot of people that have got poor mobility, they can become socially isolated.
Having been part of the 1,000 Lives Collaborative, I believe we've been given the support to work better.
My involvement with 1,000 Lives again occurs in both the acute setting, which is well established. We're trying to carry that approach out past the interface, which is the interface between the hospital and the community setting. So it's moving all that good practice that we learn in hospital towards patients' homes, and that's particularly important around falls assessment and falls prevention.
Our assessments have become better. We've all got one goal. We don't want people to fall over. We don't want them to break their hips, and that's what we're aiming at.
From an occupational therapist point of view, we work with people to try and get over those fears.
Since Dawn's been coming here and she put this appliances in for us, you know, it's been great, you know.
We assess their performance skills to do things like washing and dressing, cooking their meals, getting out of their home to access things in the community.
Because Dawn has had this sort of oval thing put on the side of the bed, and they just come out on that, you know.
We would go in and perhaps assess their manual handling needs, what type of support might be needed from some of our colleagues like social services, home care support, physiotherapy support.
When the physiotherapist came here, she did say, you know, about being careful and all the rest of it. Yeah, she had a little chat to me about that, you know. But she gave me some exercises to do.
We've had no re-referrals from a falls perspective, which is a great thing. So what we've done has obviously worked. So the patient's obviously much better off in that respect because they're at less risk of harm. As a team, we reduce wastage because we link with each other. We don't duplicate, and because of that, the patient has one assessment instead of 5 or 6. We do as well reduce variation because every one of us assesses the patient in the same way. So whoever goes out will assess that patient with the same process.
I feel more confident being out, you know, and then going into town as well. I've been into town on my own, you know, so all in all, yeah, I feel great.
So it's adding quality as well as quantity to years and quality of life.
We believe that obviously the patient is getting a better assessment of their falls needs.
We use all the resources within the team to sort of get the right thing at the right time?
I think it's the way forward because we do understand each other's roles better.
It's all about prevention.